Good afternoon, Prof. Good to have you in India again, Bengaluru. Welcome, namaskara.
Okay, namaskar.
So, to introduce Professor, Dr. Manfrini, Marco Manfrini, I met you in Rizzoli in 2010 when I came for a fellowship program.
Long time ago.
Long time. Since then, I think we are in very close touch and been managing many patients and collaboration and lot of learning of life and tumors, both in everything we have seen together. So good to have you on this Indo-Italian consensus meeting. Thanks for coming down with family, with Elena, Laura.
I am very happy to be here.
Please keep coming.
Okay.
So the reason we always feel that we are, as a sarcoma specialist or an orthopedic oncology, which is one of the most negligent, or I would say it is one of the most not so known specialty across the world. What do you say about it?
I mean, orthopedic oncology, it's a particular field that make our job very different from other orthopedic activities. So we feel strange, and people look at us in a different way, because we look and we treat very rare diseases. I started my career when these diseases were very bad. The prognosis was usually very bad in high-grade sarcomas. And then I lived the improvement and the changes due to chemotherapy, to better approach in radiology, in the diagnosis, in the treatment. And from my point of view, I lived a pioneeristic time for surgery, for reconstruction of the bone that needs to be removed and still needs to be removed, and so reconstructed. And that field is a very fascinating area to me. It was a very fascinating area in my career.
Did you ever get thought, like, of course, in Europe it is very well, they diagnose it early, sarcoma or any osteosarcoma or anything. Like right now, I remember where yours is one of the oldest departments of orthopedic oncology in the world. Professor Mario Campanacci had started, I think, in 1950s. But do you find that early diagnosis is a challenge in Italy? We find it in India.
Early diagnosis, it's a word and is not very easy to be promoted really in this field, because Campanacci was one of the first that promoted just the plain radiography.
Yes, I remember.
May be very important if done. So, and he used to say that if you have a pain in a child or in a teenager without any trauma that lasts for about 7 days, think to do a plain radiography, because sometimes the plain radiography, it's already efficient to understand the problem. Then now we have CT, MRI, a lot of fancy, but not to start with fancy test. Just a plain radiography sometimes can be, if you have a suspect of something that you don't understand, for general doctor, for general practitioner, for even for sport trainer of young boy. If you don't have a trauma but you have pain in a knee, after few days of pain, think to do a plain X-ray.
Yeah. No, I may be wrong, but today in 2025, like I say, in India, every street has got an MRI machine.
Yeah.
So, and the cost of the MRI is very, very small compared to the West.
Okay.
So I propose to the government, why don't we have, similar to Campanacci, what you said, any child with the pain, the components of the pain for 1 week or 10 days, Why don't we get a plain MRI?
If you have so many MRI available, why not?
Yeah.
I mean, they are not even
Radiation.
they avoid any type of radiation, but also a digital plain radiography doesn't is so dangerous.
Yeah. So that's why, because it's, you can subsidize that to a very minuscule of a cost, and we can do the MRI. That's what my suggestion.
Okay. If the
Yeah.
cost is so low, why not?
Yeah. I know you entered this field like I entered. Like every orthopedic oncology is not destined to be in the beginning. Nobody in the medical doctor like tells I want to be an orthopedic oncologist.
For
We
sure.
all we all standard in orthopedic. Then I entered a hand surgery. Then I entered a micro. Then I entered oncology. Then I'm sure if you could tell, how did you end up becoming an orthopedic oncology in a brief in your life history?
I mean, actually, during my medical school, I even didn't think to do surgery. I thought to do research to understand why the disease happened, and then I started to think to oncology because there was correlation between substances and cancer. Even in my time, somebody supported the idea that the cancer can be caused by some poison in what you eat. And so I started to think to oncology, and then I found an institution where they promoted experimental thesis. At the end of the medical school, we had to do a kind of
Thesis.
thesis, and I started to do something. I found an institution that suggested me to be involved in a research on immunological status after one of the first chemotherapy treatment available in the 70s that was real in a bone tumor, because the beginning of the changes of the prognosis in the high-grade sarcoma of infancy and teenage started in the 70s. And so I was involved in this research, and at the end of this research, I changed the idea. I didn't like to spend a lot of years in the lab to study cells, and so I had this field, and I could use this thesis or in pediatrics or in orthopedic surgery, because it was the name of the thesis, immunological status of patient of osteosarcoma before and after chemotherapy. And so I started to follow Istituto Rizzoli, and I followed the lessons of Mario Campanacci, and I got fascinated by him.
Yeah.
He was a great teacher, and he loved the teaching, and he was very able to make people learn about that. And so I started there. So I started with the idea to become an orthopedic oncologist.
Yeah. I mean, same with me. I went to Singapore for hand and reconstructive microsurgery. You know Professor Fogg.
For sure.
So I saw a lady of a scapular reconstruction very years back. She comes with a beautiful dress, and he asked me, Pramod, you know how he speaks. Pramod, can you make out what tumor she had? I said, first of all, did she have a tumor? My question was, is she alive? Because I came from a learning of that most bone tumors people die.
Yeah, for sure. At that moment.
Yeah,
but that time.
When I was in 2007-8 in Singapore, then she started doing all these movements. I said, wow. And then he said it was a scapula of humerus with free vascularized fibula. I was surprised. That is when I came to Rizzoli, and I met you and Mario Mercury, and literally it changed my way of thinking and biological reconstruction. I think it is made. I think did your father? I remember you said your father was into very deep learning of carving or something, right? So that's how you
He
became
was
an
a very good,
artist.
I mean, not really artist, but
Very deep.
artigianato, something that able to do with your hands. So
Artists,
yeah,
artisans.
artisans, yes, like carpenter,
So I'm sure.
like a small statue or small things done with your hands.
Yeah.
So, and I realized that using the hands was important to mold the bone that was an available tool to reconstruct the bone. So the bone is a nice way to reconstruct the bone, and you may use like a carpenter does with a piece of wood.
That is how I think you're carrying the art of doing reconstruction in the children. That's what we as orthopedic surgeons, like, even for example, Juan Valencia from Colombia, Jennifer, a lot of friends of yours, we all feel you're an artist in
Yeah, I mean,
orthopedic oncology.
I mean, anyway, now is not a problem of arts; it's a problem of knowledge and right use of the tools that you have. The first tool are the hands, but you need some other help. And nowadays, the new technology, the new possibilities to plan, to see, and to plan and to see before doing what you have in your mind. So you may realize virtually what then you want to do in surgery, and that's the new
adapting the new technology.
yeah, adapting the new technology,
Like 3D planning.
Yeah.
3D planning with much planning, everything, right?
yeah, planning everything.
Everything.
So you may plan an artificial implant, you may plan a biological implant, you may see and virtually what you have in your mind. You can show that what you see in your mind to the patient, family,
Yes.
and to discuss. This can be very useful also in the relationship with patient.
Yes. Yes.
If you can show what you have in your mind,
Yes. Yes.
probably you may get their an increase
Confidence.
in their compliance of what you do.
Yeah, that is the reason we, as you met, are engineers. I think as you said, the virtual, everything virtual, much before surgery, including a measurement of a screw of the tumor, the patient will feel, oh, this is such
in the 90s, I had to buy furniture for my kitchen.
kitchen.
Yeah. And there was this first possibility to have a rendering
Oh,
in the screen of what you have
in mind.
in mind.
In 90s,
No, in the
late 90s.
late 90s, from 1990 to 2000,
Ah.
the big store like IKEA store
yeah.
had this first possibility to show you in the screen the assembling of all the elements of the kitchen, and you see your kitchen if you have the measurement. Okay, and I started to think why we can't do
This in the surgery.
to reconstruct patients, to show them what you want to do. We use pen and a sheet of paper just to draw
Yeah.
what our ideas,
Yeah.
but it's much more efficient using
Yeah.
digitalized imaging and the app that you may now.
Artificial intelligence.
And even artificial intelligence that I never used for sure in my
No, it's
career.
amazing.
But
It's
I
amazing.
understand that can be a field
Yeah.
very, very,
Useful for us. I mean,
very useful.
I'm using it
Yeah.
regularly with whether it could be generating images, generating
Yeah.
text, prepare even the podcast we are doing. I prepare.
The world is changing so fast
Yeah.
that I understand that new tools are now available.
Yeah. With regarding to the sarcoma or orthopedic oncology, we all know that, and we right now it is our 16th year in our practice, where we have handled more than 5 to 6,000 patients of various bone tumors or tumor-like conditions. The outcome of a sarcoma, young children with first diagnosis, if correct me if I'm wrong, it is 70% is the survival rates. That means they can live anything like anybody, because this is often a confusion with many, even doctors, even the people, parents, they feel, oh, bone cancer or bone tumor means end of life. I think I,
This was true just in the past.
yes,
I think that nowadays, I don't know, because in the last 20 years, we see that level 70% of survival in 10 years, that is difficult
more going up.
to improve. So, and we, for unfortunately, think are sad for those ones that for
Could
the
not.
30%,
Yeah.
even if even a recurrence can be treated successfully. So probably 70 is just without any relapse, but after the first relapse, we may gain another at least 5-10%.
Are you bullish or are you hopeful of the present genomics and immunotherapy?
I hope so. I don't know. It's not my field anymore, and I ended my career, and I am a surgeon. So, of course, the oncologist may work on that, and
Yeah.
and I hope we'll see other improvement in the future.
Yeah, like example is the child of 28 day, as I was mentioning, is infantile fibrosarcoma, NTRK positive,
Yeah,
entrectinib is a targeted drug which came in the last 2 years. I
yeah.
mean, yeah, something like that.
Something is changing, fortunately.
Yes, yes, yes. So, if you have a message to the students or the present day doctors, what I feel is there is a lot of need of our field in our country. I don't know about the other countries, but for sure in a population of our size, we need many orthopedic oncologists or surgeons. What is your thought about it, and how do they, they should process the thing? I'm not telling you to structure the process, the liking. It's all
I
individual.
mean, today we were together in a place where we were seeing some child.
Yes.
So what I may say to young doctor without any previous experience, try to follow center where you see patient, real patient, and you see children now, and you feel and you hope, you are involved emotionally in their hope. That can be a way to think, to become in the future one of those that may treat the children, because children that are sick, and you may see them become healed, are a great satisfaction. Something that is not easy to understand if you don't look at it.
Yes, absolutely. Like as we that's purely, as you said, it is to be emotional and understanding, pure personal. We discussed in the morning that GHA, like GHA, what we did the meeting now, it is just a consensus between two countries. But Singaporeans are there, Malaysians are there. As the disease is so rare, as we are discussing, there are less than 1,000 cases at any given point of time, maybe in the world of sarcoma. We thought of collaborating and having courses across the world, across the world. We wanted to. I mean, we wanted, like how we the fellowships are getting trained. I know it's very complex across the world to train. Let it be Africa, let it be India, let it. We should have an unifying body, like it could be a 3D printing uh, body, as we morning we were discussing. Why to replicate the same protocols everywhere? On these lines, you have any thoughts of unifying the world. I'm sure with the present scenario in the geopolitics, it is getting more and more country specific in every angle. If every country becomes specific, the collaboration word is gone. But in such rare things or in certain scenarios, how do inter countries, in the thought you have?
I mean, the rarer is a disease, more collaboration you need to get enough information to cope with such a rare disease. So I think that we have to try with pilot experience and to to build connection in if we talk about small children, is something that we have to work with pediatrician, with any type of doctor that may encounter such a rare disease, and then use the technology to make possible
Yeah.
to do answers in the web and to get answers.
Yeah,
To do question in the web and to get answers.
generative AI.
Yeah. So
Yeah. Yeah.
I think that is something to start.
Yeah, maybe an AI agent which can answer the basic questions of everybody and quickly find out the solutions and collaborate. Yeah, that may be the solution.
Yeah.
So, Prof, that is what we in this event. What we are planning to do is to bring a policy in India. In India, as I always fight for it, we have a many schemes by the government which covers many healthcare schemes of smaller diseases. But as we discussed with Kumaran, even in Singapore, 1 year of treatment if anything sarcoma takes a lot of stuff from a family. Number one is a financial thing. Number two, that the parent will have another child. Number three, today in this world, a husband and wife both are working. So one mother is there in the hospital, the husband has to go to work. So all these things needs. I'm sure this is not a problem in Italy because it is national. So for us, we wanted to set up a policy because Italy was one of the first country to have a good sarcoma protocols. So in this line, I wanted your thoughts. Of course, we need the policies and government supports. Unify the whole scheme and bring out one single thing for the rare diseases is my thought. Because 60 to 70% of my children cannot afford money, logistics, because India is big. So a child in a village nearby, they cannot go to chemotherapy to Bangalore
Yeah,
for
I
one
understand.
year.
Oh, that's a very difficult question.
Yeah.
I feel lucky to because Italy has a national health system supported by the government, and nobody pay the real cost. But of course, they have to pay the travel, the trip, and the it's not without any cost anyway. And of course, we need also private foundation that support some problem. We have the luck that we have our foundation that may support with apartment for the family to support their staying close to the hospital in the period of therapy, and in some way more charity activities may help. For sure, we need
The social support.
social support. Yes.
Yes.
I mean,
This is a cause. This is
very rare diseases, and children may help because usually we said nobody want to 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 shot the Red Cross with children.
yeah. Yeah.
if we talk about children. But of course, it's much more the effort to save a child with rare diseases than to kill, like the wars do, 1,000 of children, like every day happen in this world.
Yeah, as I said, yeah, correct. Our job is to save one child. God has sent us to do that.
Yeah,
Someone may kill 1,000 in a minute.
In a
For
minute.
us to do 1 year, minimum 1 year of effort
Yes,
to save the
yes.
child.
Yes, it's true.
Yeah. That is for sure. Yeah. Thank you, Prof, for being with us on these things.
Thank you to you, Pramod.
And
This friendship is very important for both
I know.
countries.
Yes. Thanks a lot. And let's have a great event together.
Okay.
Thank you, Prof. Thanks for the event.